I speak loudly. Do you have any trouble hearing me? I don't know if we decided that the mic is or isn't working.
It's working.
It is working, so it's.
If you will all let me know, can I hear me? I'm happy to hold them. Thank you, Debbie. So I'm Dr. Kim House. I'm going to be doing most of the presentation this evening. Dr. Kaplan will be jumping in to add bits here and there with his specialty along the way. So I did meet Amy about a month ago. Just a little background. I do most of my visits virtually. I live in Michigan. I travel to Buffalo once a month to see patients in person. The rest of the month I see virtually. And it turns out as a naturopath, I thought it was going to be a little bit more difficult to make connections, but it's really actually it's working out quite well. So I'm in town once a month. Last month I met Amy and kind of discussed just cancer care and what we do at home. And she said, this is perfect. Let's just talk about that. So I kind of made a presentation on just what kind of we do at home and which areas we assess, which areas we find really important. Just kind of giving you the information about that. So we're not going to dive too much into science. Again, if you have questions, we'll answer those later. So I got to figure it out. So here are the topics we're going to discuss. A lot of lifestyle stuff, right? So when we're talking about cancer prevention and recurrence prevention, we're talking a lot about lifestyle factors here, right? There are definitely medications that you're going to get in your conventional medical setting. We talk about all of those as well. We talk about how to optimize your body while you're utilizing all of those tools also, right? But really, we're going to dive into your lifestyle modifications tailored to each individual, right? Because we all have different needs. We all have different exposures. Speaking, oh yeah, sorry. So cancer, as we know, is very complex. It's very in-depth. It involves many systems, the immune system, the metabolic, cellular metabolism, and many functions of the body. So cures, but studies show that there are a lot of ways that we can help optimize health and reduce your risk of occurrence and risk of recurrence. Rob, I'm not sure what happened here.
Not sure.
Okay.
Not unplugged.
Using it as a prompt to kind of be my speaker, but I can go over it. So in the conventional medical setting, I'll just kind of keep talking. In the conventional medical setting, if you have said cancer at said grade, you get said treatment, right? And every person that I've met who has had cancer is very dismayed at that progression. It works really well for some people. It's really important therapy. But there's a lot of things that people want to do on the side, right? But they just can't get the information from through that system, the conventional medical system. And so we optimize a lot of those things. And so we start with diet primarily. I don't like the term diet because, especially with women in the room, it can be pretty triggering, right? But we're talking about the foods that we generally eat, the things that we consume. Really, when I'm talking about it, I'm talking about what do your cells need? What does your body need? What do your systems need? Right? So the nutrition in what we put into our body feeds our cells, right? It feeds human cells, it feeds cancer cells, right? And so we try to optimize how to feed the human cells and not feed the cancer cells. There's lots of ways to do that. So if we're looking at prevention without cancer, we're looking at more of a Mediterranean style diet. That's what studies show is one of the most generalized diets, right? For overall, when we're looking at studies that can help reduce the occurrence first of cancer. Okay, that's a plant-based diet. If you're not familiar, it's more of a plant-based diet. So we're looking at whole grains, fruits and vegetables as the base, and then we add in some healthy fats, and then we add in some meat. And typically in the Mediterranean diet, it's more seafood, fish-based meats, but you can have chicken and beef and lamb and all those things also. So that's kind of the general for recurrence. Now, when we're looking at prevention of recurrence, we're looking at more of a low glycemic index, right? We know that sugars feed metabolism of cancer cells. We also feed metabolism of our cells. And so how to optimize, and so when we have a recurrence, we're looking at lower glycemic diets. Now, a lot of times, so that would be various diets. Now, at home, we don't just take generalized either, right? So these studies are great, but they're done on massive amounts of people, right? But you're not a massive amount of a person, you're one. And so we're looking at many different factors of you, your cancer, your health, your genetic profile to optimize your health in a therapeutic way, right? So that's what I call a therapeutic diet. So we might introduce a therapeutic diet depending on where you are in your prevalence of cancer state or post-cancer treatment. Okay, so and those are really important because I don't know if anyone has ever looked at how many diets there are, and there are so many, it's overwhelming, right? And so how do you pick the right one for you? And there's, okay, here we are. I talked a lot more than that slide.
Are you there?
Yeah, we just keep it there because I've got it, I'll go over that. Okay, so there we have the Mediterranean diet and the low glycemic diet. I put a few, let me just leave it up, so I'm gonna get that one. I put a few examples, right? So green vegetables. We know that green vegetables are healthy, but why are they healthy? They help support our detox pathways. They support detox of the cells as well as the blood. They provide folate, which is an absolutely necessary nutrient at the cellular level for all cellular regeneration, right? Which is a big thing when you've been through cancer. And then minerals. Brassica vegetables, so if we're doing breast cancer, right? We're looking to many of you or anyone who has breast cancer, we're thinking, is it hormone positive, right? So we're looking at how you're metabolizing estrogens, more than progesterones. And then we're looking at brassica vegetables. Now you have to eat a lot of it to get the amount of indole-3 carbinol you need to do a therapeutic dose. But when we're looking at therapeutic diets, it's an important part of it. So indole-3 carbinol or I3C binds estrogens and helps carry it out of the body. Okay, so that's an important thing to have. Isothiocyanates help support detoxification, and they're also directly kills cancer cells. So brassica vegetables, we don't just want to generalize, say, eat a bunch of brassica vegetables, that's cabbage, broccoli, bok choy, things like that kill. But there's a reason, right? They're really supportive for cancer specifically. Fiber. So fiber comes into our diet in many sources. And we're talking about fiber here. We're talking about feeding the microbiome. This is something I didn't dive too far into this topic, but I really wanted to. The microbiome is vitally important for every system in our body, right? But when we're talking about estrogen dominant cancers, the microbiome is vital to reducing your estrogen load in the body. So we talk a lot about the liver, we talk a lot about hormones in general, but how do we get those out? The liver changes the shape of estrogen, and then it needs to dump it through the bile into the intestines, and then we have to get it out. So that bile needs to bind to fiber and gets carried out. Also, we have to make sure that the microbiome, so the fiber feeds those good bugs in our gut. So there's good bugs, there's bad bugs, there's neutral bugs. Why are good bugs good? They're good because a number of reasons, but in estrogen dominant cancers, there is this estrobiome that helps us actually, so there's actual certain microbes in our gut that help to make sure that we don't break apart and reabsorb that estrogen. So we have to make sure we have a good, healthy gut microbiome. So fiber does a couple of things. It helps bind extra estrogen and take it out. It helps support the immune function because the microbiome is vital for the immune system, right? I don't talk enough about the immune system in this talk either. But we talk about supporting the immune system. This is me wanting to dive down all the rabbit holes. But we have to support the microbiome and support the immune function, and key to that is supporting that microbiome. So feeding the microbes. Fiber is a good way to do that. It also produces butyrate. Butyrate is a magical substance from those good bacteria. So it's a short chain fatty acid. So these bugs, they munch on the fiber in our gut and they produce lots of chemicals. The good bugs produce chemicals that we as humans need. The bad bugs produce chemicals that are bad for our health. That's the only difference between the bacteria is what they produce. This butyrate not only helps strengthen our gut, strengthen our microbiome, but it also is anti-inflammatory in nature. So it helps support our immune system and it helps protect all of our systems. So our microbiome is vital to any therapy, but specifically with cancer health, cancer prevention, and cancer recurrence prevention. Green tea is a wonderful botanical, and here we're just talking about the polyphenols, which help decrease cancer growth, right? So again, if we're talking about a therapeutic dose, if you're in active cancer or you're just outside of therapy and you're in remission, we might not be just drinking green tea, right? We might be doing a supplemental support, but here it's just drinking 3 to 5 cups of green tea is actually really can reduce the growth of cancer cells. And then there's other things that we're gonna assess too, your omega-3 ratio, your vitamin D levels. We're gonna talk about reduced caloric intake. Now, again, diet, reduced calories, trigger. But what we're talking about here is we're talking about reducing the amount of stored energy, right? Which we typically call fat. Why is that important? Because fat is really inflammatory and it produces its own estrogen, right? So we're not talking about the ovaries producing estrogen, we're talking about the fat. And so a reduced calorie intake, and we have measurements for how we do that, right? Can help be supportive for recurrence, occurrence and recurrence prevention. And then intermittent fasting. Intermittent fasting, the big rave these days. It's good for some people, it's not good for other people, but it can be really helpful with the body clearing out unwanted toxins, clearing out unwanted chemicals, breaking down things in the body that it doesn't want or isn't serving it. After diet comes stress management. Really important. I was actually just perusing the selection of all the papers back there. And I was really happy to see about coping with the stress, coping with cancer. I work a lot with chronically ill patients and less amount with cancer, chronic fibromyalgia, chronic pain. And it is its own specific trauma, right? So illness is a trauma, right? Aside from its own stress being sick, we all live life, right? Stress is a big killer to the immune system. So stress management is critical to good immune health. What happens is psychological stress is what we usually think of, right? But internally, we have our own stress loads going on from our immune system, right? Or from our microbiome or our gut health, right? It's creating the same stress chemicals. So we have the stress load in our body. So when we add psychological stress on top of it, our nervous system goes, or we feel like it. But really what it's doing internally is it's creating these hormones, right? Cortisol, which is an amazing hormone. It's our wake up hormone. It helps with it's an anti-inflammatory, but when we have it around chronically, it starts to reduce the immune system activity. Actually, we have it around short-term immune system activity. Most of us don't just have short bursts of stress. We have chronic stress. So it reduces your immune system activity. That decreases surveillance. When you have decreased surveillance, cancer cells grow. It increases blood sugar. Well, we also know that blood sugar, having too much blood sugar around is bad for any disease. It's bad for any system, right? And so having excess cortisol around is going to put you at risk for many diseases, including cancer. And it stimulates fat accumulation. So cortisol specifically will start to store fat, chronically specifically. And again, we know that too much stored fat around can be inflammatory and produce more hormones in general. So and then we have adrenaline. So adrenaline, epinephrine specifically. So there's norepinephrine, there's epinephrine. They're made in our adrenal glands also in short bursts typically. It's a shorter acting hormone, but it blocks cancer cell death, right? So again, if we have chronic stress going around, it's going to reduce your immune system function and its ability to do its job. Now, stress management, there's lots of tools. We're going to get to the positive ones next, but a lot of in our culture, drinking alcohol is very commonplace, and a lot of times we use it as self-medicating. When you go home and have a glass of wine tonight, there's no problem with that if we're not doing it regularly. But if we're in cancer, if we have cancer or cancer therapy or post-cancer, that is 100% sugar, and also it's a potent carcinogen, right? So we're just adding fuel to the fire. So we need to do healthy stress management therapies. The most important, the easiest accessible one is breath work, right? We can talk about meditation, which is really highly studied and wonderful, but a lot of people don't have time or don't think they have time or don't think they can do it. Well, everybody's going to breathe. Okay. Breathing is the fastest way to disengage that nervous system. It's the fastest way to bring you from a high stress state to a low stress state. And all you have to do is really sit and take a deep breath. And it says diaphragmatic breathing. What is that? The diaphragm is here. When you take a breath in, your diaphragm should go down. Your shoulders shouldn't go up. Okay, so your belly should come out and back in. Okay, it takes practice if you haven't been doing it, because a lot of people breathe here, really, and go like this. We don't even know we're doing it. That actually leads to poor stress response. Okay, poor stress response, lower immune function. So working on your breath work, even if you had taken 5 deep belly breaths twice a day, that's not nothing. Okay, you can do it for 5 minutes, even better. You can do it for 5 minutes twice a day, all the better. What it's doing, it's not going to change. It will change everything in the moment, actually. But what it's doing is it's strengthening your stress response. So when you're in a high stress situation, you don't peak as high and you don't stay up there as long. So you might peak lower and you can come back down. It helps you get out of that fight or flight or that high stress chronic state. Okay, so practicing breath work twice a day can do it. It's just like working a muscle. You're just working that nervous system to not be so reactive. Yoga combines breath work with movement. We're going to get to movement next. And now we're going to start adding in things that how do we blend these into our practice. We do have a wall yoga offering at home. A couple of wonderful teachers that really work individually to help people with their therapies, whatever they're working on. But again, that's working with breath work combined with movement. Meditation, again, I mentioned that briefly, really highly studied, super effective. Our culture is slow to jump on that bandwagon, but that's okay too. And we do offer, because we can do breath work, but we do offer a brain spa. So what is a brain spa at home? So it's, we do IV nutritional therapy, which I'll get to a little bit, but it's an IV, which has nutrients for the brain, specifically calming the brain. There are a couple of things, glycine, phosphatidylcholine, that are offered in there. Sorry, we do a little cacao ritual. Sorry. So we're trying to stimulate a lot of the senses to bring you back into your body, right? A lot of times we're so busy, we're not in our bodies, right? Health is happening here, right? But we're all here, right? So when we're working with people, we want to bring them back into their body. We got to get you to understand what's happening in here. So the brain spa helps stimulate the different senses. So we do a little cacao drink, which is a really tasty hot chocolate, basically. And we do an IV to help give nutrients to help calm the body. And then we do a virtual reality. Now, again, I'm a naturopath, I don't love screens. I did this virtual reality and I use the visualization of this virtual reality meditation all the time. Like it was so helpful. So there are different ways. So if you're not, say I can't do meditation, there are lots of ways to get into the meditative state by utilizing the visualization. And then there are lots of other healthy stress management techniques, biofeedback, psychotherapy, hypnosis, creative art, endless ways. But again, it's about decreasing that nervous system stress response so you don't peak as high and you don't stay there as long, keeping it down. Toxic. I thought movement was next. Toxins. Okay. Toxins. So our world is exceedingly toxic these days. I don't get through any visit without talking about detoxification and maybe what that means. So lots of toxins enter our body through our skin, through our lungs, through our food, or through our gut. And then they travel around in our body. Now, when anything is in our body, it circulates until we can excrete it. Okay. Sorry, I'm jumping ahead to the next slide. So when we have a higher toxin load, right, we're going to be, all the toxins need to go through a process called detoxification that happens in the liver. So detoxification is this big word. What does it really mean? In my world, we talk about cellular detoxification, we talk about toxic or liver detoxification, and then we talk about bowel detoxification or getting it through the kidneys. So what I'm talking about here is the changing the shape of these chemicals, right? Through this detoxification process. There's phase 1, phase 2. I'm going to jump down all those rabbit holes, but it's the same processes that you have to get rid of your estrogen and your other hormones in your body. So the higher toxic burden you have, the slower things are going to go through those phases. The slower you're going to be able to get rid of your toxins and your estrogens, and the more you're going to have circulating. Now, both toxins can be carcinogenic, and if you have estrogen dominant cancers, that's going to potentiate cancer also. So it can increase your risk that much further. So what do we do about that? I'm sorry, I listed some here. Xenohormones. These are chemicals that act just like hormones in the body. They come into our body mostly from meat sources. Because they act like hormones, they potentiate cancers, breast, prostate, and colorectal. They're found in non-organic meats such as beef and farm salmon are two of the highest sources. We have parabens, those are in cosmetics, so you'll notice a lot of cosmetics list paraben free. There's lots of other chemicals that are free. The parabens are specific carcinogens. Nitrate fertilizers boost food production, but the runoff from them get into our water, and then that potentiates, when they get into our body, potentiates cancer cell growth. Mycotoxins. I work a lot with mycotoxins because I work a lot with chronically fatigued people, but mycotoxins are present and a problem for many disease states. They're carcinogenic. They're found in mold from food and water damaged buildings. So we have a way to assess these, see if you have a need to be supported with specific toxins, mycotoxins, or even helping break down brain hormones. What do we do? Number one, we're asking everybody about your bowel movements, whether you like it or not. Bowel movements are really important to ensure that you're getting rid of those toxins daily, right? If you're not getting rid of them, you're reabsorbing them and you're just recirculating and starting the process all over again. So we want to make sure that people are having a complete daily movement. We can run toxin panels. Again, we can look for those environmental toxins. We can look for the mycotoxins. We can look for heavy metals. Infrared sauna. So sauning, maybe some of you have heard, is really helpful. Infrared can help stimulate the cellular detox, right? Gets a little bit into the cells. Sauning itself does many things that's helpful for cancer and many other disease states. But what it's going to help do is help stimulate the heat in your body. It helps increase enzymatic processes. Remember those phases, right? There's a lot of enzymes that happen in there. We're increasing that happening. And we're sweating. So so our ways that we mainly excrete toxins from our body, our waste are through our stool and our urine, right? But then we have secondary methods through our skin and through our lungs. And so when we're sweating, we're also dumping a lot of toxins out that way. And it also strengthens the immune system. So being in an infrared sauna is incredible for your immune system. It can be really uncomfortable if you're not used to sweating. But the more you do it, the easier it gets. And if you're uncomfortable sweating, that means that probably some of your detoxification channels are blocked. And probably you need that therapy, or you need to excrete some toxins. We do IV nutrients that can be specific for the detoxification process. Those enzymes through phase 1 and phase 2, they're reliant on nutrients, right? The same nutrients that are really important for genetic function, for generating healthy cells are also important for the detoxification process. You can get those through food, you can get those through IVs, you can get those through oral supplements. We also do glutathione. Glutathione is our body's mop in our body. So it goes around and it cleans up oxidative messes. Toxic messes. And we're just starting this new therapy, which Dr. Kaplan might want to talk about a little bit more because he did the conference, not me, IV UV light therapy. And here I put it on because it can stimulate the lymphatic system and detoxification, but it can do a lot more, especially with integrative cancer therapies. And then one important resource is the Environmental Working Group. They do a really good job of assessing the toxic load of various products on the market. Because I mean, even myself, like I don't know what products have what in them all the time, and there's big names and who has time to read it. So it's a good place to go to check on your foods, your cleaners, your cosmetics, to clean up those chemicals that are in your environment and in your food. So again, not everybody can eat organic. Organic's not available all the time. How do we navigate this? Well, they do a really good job at assessing the different foods, which ones have more chemicals and less chemicals. They call it the clean 15 and the dirty dozen. So the dirty dozen, you want to avoid those if you can conventionally, and the clean 15 are pretty safe to eat. But they do the same thing for cleaners and cosmetics. They give a green light, a yellow light, a red light. So sunscreen, for example, there's a lot of toxins in sunscreen. We're putting it directly on our skin, and then we're opening our pores because we're hot. So you can check those toxins. I have some slides in here on movement, and they don't seem to be here, so I'm gonna maybe flip through. Yeah, let me flip back a little bit.
Oh.
Aha, there they are. Okay. Exercise. I like to call it movement, body movement. What do you want? I don't like word. I'm female raised in America. There's trigger words, but we need to move our bodies, right? We need to move our bodies. It's really important. And 175 minutes per week of moderate intensity exercise can reduce the prevalence of many cancers. What is that? It's 35 minutes, 5 days a week. Moderate intensity means you get your heart rate up so you can talk, but you can't sing, right? You might start sweating. It's a pretty good thing. Sweating is good, remember? What does it do? It's going to improve your lean muscle mass. Muscle is shown to be an organ, everyone. We're now in this, we finally can call it an organ. It is not only producing chemicals, but like eliminating hormones from your body. Okay, it is very active and dynamic. It's important, really important to have lean muscle mass for cancer and all diseases. And it reduces your fat, right? Again, which leads to reduced inflammation, hormone burden. It's going to move that lymphatic system. Again, 3 systems I didn't talk as much as I wanted to about, but the lymphatic system, it's basically our sewer system. Okay, where our blood, our blood pumps on our heart, right? Goes through our arteries, and where it meets our veins, it gets really leaky, okay? And the plasma flows out of there, and so do toxins, right? And it goes into our lymphatic system. It's no longer on a pump. It's not pumped by our heart. It's pumped by our movement, our muscle movement, okay? So it has to get back up and recirculated and cleaned. But if we're not moving our body, we're literally sitting in our toxins. We're sitting in our super. And so we need to move that lymphatic system. Also, the lymphatic system is the superhighway for the immune system. Okay, so if it's bogged down with toxins and it's not moving very well, our immune system's not happy. Aside from moving lymphatic system and helping the immune system, it also supports our immune system strength and activity in general. Okay, so we all need that. Everybody in the world needs a stronger immune system these days because of our toxic load and very many other things. So exercise. And then, a new study last year showed that it's supporting human cell metabolism, right? And it's decreasing cancer cell metabolism. What does that mean? It's basically helping your body utilize energy more and decreasing the ability for cancer to utilize energy, which is really great. Okay, so that was movement. Thanks for going back. Specialty testing. So where we at? Yeah. So again, going back to conventional medicine, I was trained in conventional medicine. I did not do a cancer related anything. But you're going to get a very standardized protocol, right? You're going to get the labs that you're going to get. Some doctors will do a little bit more, but most are not really going to take the time to maybe speak to you individually, or even take time to learn about more tests or run tests that you might have interest in. We run a lot of tests. We run a lot of serum testing, blood testing, but we also run a lot of specialty testing. So we're going to assess your hormone levels, and not just your estrogen and your testosterone and a few breakdown products that might be running your conventional medicine study. We're going to run a whole panel. We're going to check your adrenal gland function. We're going to run a whole panel of hormone testing. But on top of that, say you've had cancer, or you're working on cancer prevention, or you have a family history of cancer, we're going to talk to you about selective hormone testing. So we run salivary and urine testing. So the salivary gives us a different read than your blood testing. So the salivary testing is going to show us your levels of free hormone. It's also going to give us a really good read of that cortisol level. So cortisol, that hormone we talked about earlier, it's our stress hormone, should spike and it should come down beautifully during the day, be low at night, right? A lot of us don't spike very high and we're pretty low, or we spike and then we come back up. We want to fix that, right? That's a problem for your immune system and many other things. The urine sample is going to determine your metabolite ratios. What does that mean? So your estrogen gets broken down through those phases, phase 1, phase 2 of detoxification. When it's doing that, it's changing the shape of it. Now it will change the shape and it will become pro-inflammatory or it will become anti-inflammatory. Okay, when we're working with, well, anything, we want it to be more anti-inflammatory in nature and not pro-inflammatory. The pro-inflammatory estrogen metabolites are the ones that damage the DNA. Okay, so we want to assess your ratios of pro and anti-inflammatory, and then we can help build a treatment plan that is really specific for you to help address that if needed. We monitor that. We'd monitor that yearly. I'm going to jump over to the right side of the screen and talk about the genomic testing next, because it kind of plays in with hormone testing. The first one up there is the nutrition genome. This is the one that we do that tests your individualized genetics. Why is that important? For a long time, I used to say like, oh, genetics aren't that important. It's how they work, or, like how the environment that makes them work faster or slower. Well, it is really important, especially when we're really digging into cancer. But the cool thing about this one is it also helps us optimize the diet that your genes want, right? This is where we start to piece apart. What diet is perfect for me? We don't know. We don't know how your genes want to be fed until we do this, right? So it will tell us, do you have more of the hunter-gatherer genetics? Does it like less carbs or even no carbs, right? It will tell us that. Or does it like more of the moderate agricultural diet? And you do well doing carbs. It shows us how well you utilize saturated fat, right? This whole cholesterol thing, is it saturated fat, it's carbohydrates? Well, it really depends on your genetics. That's really what it boils down to. And so it gives us a really good read of how to do that. And we also need to see some markers specific for cancers, right? So again, our genetics, our code, and then we can optimize them. We call them the light switch, the epigenetics turn on and off, how those codes work. Well, if you have a slow gene that isn't really surveying cancer very well or processing some of these hormones very well, and the environment on top has dimmed that light switch down and slowed it down further, well, that's going to put you more at risk, right? So we want to know that, and then we can help clean up that environment in the ways that your genes need, so that it reduces your risk, so that that gene can work effectively. Signatera, Rob mentioned, sponsored the dinner. Signatera is another test. This is not testing your genes, it's testing the genes of cancer tumor cells. So it's circulating tumor cell DNA. So it is a really amazing early detection mechanism or test. So of course we can do it on anyone who has not had cancer, but it's really important when we're looking at cancer recurrent surveillance, right? So you can do all the things in your conventional medical center or setting. They're going to find it when you have a tumor for the most part. This is going to find it before there's an actual tumor recurrence, hopefully, because we do have a Dr. Kaplan can talk more about that if he wants to speak any more on Signatera, because he has been utilizing that a lot longer. So we do the middle section here. We talked about the toxin testing. One thing I didn't mention about toxins is in our environment. So a lot of our scented candles and fragrances, those are also hormone disruptors. There's a lot of hormone disruptors. There's so many hormone disruptors, and our sensitive female bodies take the hit. So cleaning up your toxins in your home, looking if you have stored toxins, we can do that and we can get them out appropriately. And then it's an image, but it's the sonosine, which is a whole breast ultrasound that Dr. Kaplan has started utilizing in office. Again, this is a way to detect cancer tumors growing before they're more detectable on mammograms. It also gets, so our breast tissue comes from the sternum, the center of the chest here, all the way over to the mid-spine of our ribs, right? How much does the mammogram get? Not that much. So the whole breast sonosine is a full breast tissue scan. So it's testing all of it, which is important. And that brings us to cardiac. So it's complex. There's a lot of modifiable lifestyle factors, right? But it can be really maddening when you're trying to do it alone, right? So we try to individualize it. What are your risk factors? What does your environment look like? What does your diet look like? What was your cancer, right? All of those are really important pieces to building an individualized plan. The goal is to strengthen the immune system, reduce the toxic load, and get your metabolism back on track, because we know that those are three big keys to cancer. And then, yeah, we do our personalized treatment plans to help get you your best health. And now we'll do questions and answers, unless Dr. Kaplan has anything on all of that.
Well, I think we'll just wait for
Questions. Okay, great. Questions. Yeah.
Thank you.
I have a lot of questions, but I'll keep it down to the minimal. Mycotoxin. I'm a follower of Doug Kaufman, Know the Cause.
Yeah.
And I listen to him a lot. I was forced by my brother who was out in Arizona. And he, back in the day, told me, because I had breast cancer, and it's funny to see what he's saying, when cancer starts off small, it's fungal. And they start talking about fungal, and if you talk to any doctors about being on any antifungals, or even if you go to Quest Diagnostics and ask for mycotoxin testing, which we did recently for my mother, they don't know anything about it. I was on the screen with the guy working there, going down all the codes, because all the codes are different for all the facilities, hospitals, and labs and all that. And I was going down everything with them, because you allow me to do that. And I'm taking pictures. I'm like, where are the mycotoxins? Because fungus can produce mycotoxins, which are poison.
Yeah.
So if you speak to any doctor, any lab technician, nobody talks about this. And then I want to know the difference between a pathologist and a mycologist. Is there such a thing? You know what I mean? Like,
Yeah.
so in the send any kind of blood work, it's almost like, I know there's like this my lab doctor or something like, there's all these certain kind of labs that won't accept it. When my mother was at Suburban, she didn't have cancer, but she had stuff that we were kind of wondering, like, is it fungal starting, kind of thing that just kind of builds up, because you did mention about mold toxicity, new housing, old housing, everything and anything, and a lot of times too with older people, it's accepted that people's toenails turn yellow. They're like, oh, it's just, that's what, you know, that's not normal. It's not right, but the doctors, oh, yeah.
It's common, so.
Right. You know, just like now, which brings me my next thing is vitamin D. You touched on vitamin D, and I noticed with a lot of people in my life, everyone's vitamin D was low when they had an inflammatory process going on in their body, including my 2 children, from skin reactions to eczema and all this other stuff. I just happen to know their vitamin D because I pushed to get a vitamin D check. Every time you push for a vitamin D level, the doctors say this, well, a lot of insurance don't cover it, and it doesn't matter, everybody's vitamin D is low. And that's baloney. It really is, because then also too, a lot of people are told, just take over the counter. And correct me if I'm wrong, but if you just go over to the pharmacy and get vitamin D over the counter, you're just chasing your tail if you don't know what your vitamin D level is. I take 50,000 IUD weekly. I was told, get that bolus in, get your vitamin D high, then maintain it with a dose over the counter. So, and I wanted to know what you thought about that, because I have seen a difference with the way I feel and a lot of other things, and with my kids with their skin conditions, because now we monitor their vitamin D. And you know, I feel it's a very important vitamin that a lot of doctors overlook and they do not talk about it. It's very bothering because, like I said, 3 people, including my mother, we all know their vitamin D levels. Not saying low will cause it, but if you have something low, if you have an inflammatory process going on, guarantee your vitamin D levels are probably low. You know, I mean, but not saying, like I said, like vitamin D would cause it.
Sure,
You
yeah,
know,
and multifactorial.
Right.
So, just to talk a little bit about vitamin D, because it is really important for immune function, right? So if you do have an inflammatory process going on, typically like from the immune cells are creating these inflammatory chemicals, and they do utilize a lot of vitamin D. Vitamin D is used from the genetic level, as a hormone. It works on so many things. And anyone that lives in this latitude, unless you're taking it, or you spend a massive amount of time in traveling down to Florida, even this time of year, you can't make it. You don't have enough, right?
And if you don't have the absorption, if you get irritable bowel, colitis,
Yes,
Crohn's,
well,
something
you're
like that,
taking
right?
orally, right? So if you're in the sun, you're making it in your skin. Just the best way to get your vitamin D. Of course, then we got to talk about lots of risks about cancer, but skin cancer. But yes, vitamin D is really important, and I wish everybody did have their levels tested. We do test people's levels a couple times a year.
Done by physicians. I mean, and also now lately, a lot of people are getting notes from their insurance that they're not covering the testing.
It goes on and on. So what happens in conventional medicine, you worked in conventional medicine a lot longer, is that we can know something for 10 years, but it doesn't get translated